Hi, I'm Dr. Tallis Barker from waterfasting.org, and today I'd like to take a look at ketosis, specifically at the way that not all ketoses are created equally. We're going to do that by comparing and contrasting fasting ketosis with dietary ketosis. Before we get into that though, I'd just like to back up and take a look at the word ketosis itself, because as much as 15 to 20 years ago when I first got into fasting, hardly anyone had even heard of the word. It's now a word which has exploded into the public imagination, public consciousness. And it's wonderful that knowledge has spread like this. But in doing so, there are definitely misconceptions out there about what ketosis really is. So what ketosis is not is detox. It's not healing per se. All ketosis is an engine. It's a metabolic engine, the fuel of which is fat, or if you want to get more precise, the fuel is fatty acids and ketones. Now, just like a combustion engine, which can come in all sizes, the same applies to ketosis. And just like with a combustion engine, you've got a lawnmower on one hand and you've got a Ferrari on the other. They come in all different shapes and sizes. The same applies to ketosis and what is driving that ketosis. So now we're going to take a look at the physiological differences between fasting ketosis and dietary ketosis. It's a little bit like comparing the specs on two different engines. We can measure ketones, which is, as I mentioned before, one of the elements which can drive ketosis, in two ways. You can either measure your blood or your breath ketones, and this will give a very precise measurement, or you can measure the presence of ketones in urine, and this is done through a so-called keto strip. Now, when we do start to look at the numbers, when you are going into ketosis through a water fast, your ketones are going to rise through the first 5 days, more specifically from the second day, because you do need to wear down your glycogen in the first day. But by the time you hit approximately day 5, and this is pretty reliable in terms of the time frame, you plateau out at where your maximum ketosis is going to stay for pretty much the rest of the fast. And that level is also very reliable, between approximately 5 and 6 millimoles per liter. Millimoles per liter is just the concentration of the ketones in your blood. Now, when you compare that to the level of dietary ketosis, once you've been on a keto diet for usually several weeks in order to build up your ketones, you're going to end up, if you're lucky, somewhere between about 2.5 and 3 millimoles per liter. So approximately the depth of your ketosis on a low-carb diet, a ketogenic diet, is approximately 1/2 of the strength of the power of the ketosis on a water fast. That's a big difference. Interestingly now, if you decide that you want to measure your ketones through a keto strip, you're going to find on a water fast that usually within the first couple of days, you're hitting that deep purple color, which usually represents deep ketosis. The point being that keto strips are really only designed to cover dietary ketosis, and they really only are sensitive up to approximately that 2.5 to 3 millimole per liter concentration. When you're water fasting, your ketosis is going to continue to evolve and to deepen and to strengthen well beyond anything that a keto strip can measure. Now, one other thing which is interesting is that if this were truly the only source of power in your fast, well, it looks like your energy levels on a fast should be about twice what they are when you're on a keto diet, right? Because 5 to 6 millimoles per liter on a fast, 2.5 to 3 millimoles per liter on a ketogenic diet. There's another factor going on here though, which is why you definitely do not feel like you've got double the power on a water fast than when you're just eating a normal ketogenic diet. And that is because, of course, there's blood sugar, blood glucose, as part of the general equation. And as much as ketones, the level of your ketosis will be much deeper on a water fast, when it comes to blood glucose levels do tend to be considerably lower on a fast compared to on a keto diet. So just very briefly, if you're on a keto diet, your blood glucose, assuming you don't have blood glucose issues with instability, is typically going to be in the range of 90 to 100 milligrams per deciliter. Whereas in a fast, once you've really developed that ketosis, your blood glucose levels will have sunk considerably lower, usually in the region of the 60s, 60 to 70 approximately, 60 to 70 milligrams per deciliter. Now these numbers are just a ballpark, but it does illustrate a very simple fact that on a fast, yes, you have much stronger ketosis, but that is complemented by a much lower level of blood glucose. Whereas in dietary ketosis, yes, it's lower, but your blood glucose levels on a ketogenic will be considerably higher than on a fast. In other words, approximately the total amount of energy, ketosis plus blood glucose, will be about the same. The most important thing I'd like to talk about today concerns fasting ketosis and dietary ketosis with regard to detox and healing. There's a huge amount of misunderstanding here. I have many clients who will come to me having already been on a ketogenic diet because they naturally assume that they're already detoxing. Nothing could be further from the truth. Yes, being on a ketogenic diet will give you a running start, as it were, into the metabolism of fasting ketosis, but this is entirely different from developing the kind of detox which will occur on a water fast. Let me explain a couple of reasons why this is the case. Adipose tissue, your fat cells, are a wonderful place for the body to sequester and isolate fat-soluble toxins. When you're in ketosis, you're going to be drawing on the fatty acids within that adipose tissue, and in doing so, you can draw out the fat-soluble toxins for detoxing. When you're in dietary ketosis, though, it's not that simple. A couple of reasons. First of all, a lot of the fats that you're going to be burning will be coming directly from your diet. You know, that's why it's called a ketogenic diet, because it has a lot of fat content to it. That means that the fat from your diet totally bypasses fat cells, and in doing so, there's just no way for you to be drawing out fat-soluble toxins. Now, the fat which you might be drawing on during a ketogenic diet, yes, it's possible, but generally speaking, you're going to be effectively returning again and again to the same fat cells, for lack of a better word, let's just say surface level fat cells, to draw on the fatty acids within them. So you're never really getting to deeper levels of fat where you can continue to draw out more and more fat-soluble toxins. In a water fast, of course, your only source of fuel is from fat, from adipose tissue. And as a result, you're going to burn through deeper and deeper and deeper layers of fat, drawing out more and more and more fat-soluble toxins. The other side of the equation concerns really the ability to detox from these toxins, as well as toxicity in general. Now, when you're on a ketogenic diet, your liver has a big job in terms of emulsifying, digesting fat effectively. It's got to produce a lot of bile to break the fat down. The digestive role of the liver is huge when you're on a ketogenic diet. And because every organ has only a finite amount of total power, that means that the detoxing role of the liver is pretty limited. And keeping in mind that the liver is our primary organ of detox for the whole body in everyday life and on a water fast, it really does put a glass ceiling on the amount of detoxing that you can do. When you're water fasting, not only are you not having to emulsify fats, there's no digestive work for the liver at all. Because of this, the liver can really devote a maximum amount of energy into the detox. And in doing so, it's going to be much more efficient at breaking down toxins as part of the whole detox process. To take this to just maybe the most frighteningly clear illustration of why keto diets do not detox, there was a meta-study in the medical journal, The Lancet, back in 2018, which looked at a huge range of different people, tens of thousands of different people on different diets of all sorts. And what it noted is that people who were on low-carb diets had a life expectancy of 3 to 4 years less than people who were on no particular diet at all. It doesn't get any more black and white than that. So having a big burden on the liver through having to digest fats every day is not the best thing for your detox. I don't want to say there isn't a time and a place for ketogenic diets. There certainly is. But when we're looking purely at the detoxing role of ketogenic diets, they are very, very limited, whereas water fasts, as we're all very aware, are about the most powerful thing you can possibly do in order to enjoy the benefits of detox and healing. I hope this clears up the differences between fasting ketosis and dietary ketosis, and I hope you enjoyed the video. If you did, please hit the like button, or even better, subscribe. If there's anything I didn't cover and you'd like to hear about, or if you have any questions, feel free to leave a comment, and I'm very happy to respond. I'll look forward to seeing you next time.